You want to wait till there are 300 people?
Pete, with the questions, how does the Q&A section work? Are you gonna call on the Q answer, like how, or should I be the moderator of the Q&A? How does that work?
We can both do that. I'll kind of keep an eye on the chat, and also sometimes people will raise their hand and it looks like this when they do.
Yep,
I don't know if you see that.
I see that.
I think we usually try to ask for student questions first. Leave the first opportunity for students and then just open it up to everybody. But yeah, either you or I can, follow the chat, or both, and just it's kind
maybe
of
I'll let you be the main. Maybe I'll let you be the main moderator, Pete, and then but I may chime in if I see a question that I know would be a good one, or see something in the chat.
Sure, that sounds great.
Okay.
I would say
go
ahead.
Should I get started, Pete?
Yep.
Okay. Well, hi, everybody. Welcome to the AOS Colloquium. Nice to be together, even as we are apart. And for those of you who don't know me, I'm Tracy Holloway, and I'm a professor in the department. I'm also in the Nelson Institute for Environmental Studies. And so it's really exciting to me to have as our speaker today, Dr. Jonathan Patz. Jonathan and I are both housed over in the Nelson Institute Center for Sustainability and the Global Environment, SAGE, and he and I do a lot of work together, and his work really is connecting global health with atmospheric science in many different ways. And so I'll give his overview of his bio here, and I think you're in for an exciting talk. So Jonathan Patz is the director of the Global Health Institute here at UW-Madison. He is in SAGE with an appointment in the Nelson Institute and also in the Department of Population Health Sciences. And he has his MD from Case Western Reserve University, Master of Public Health from Johns Hopkins, and before that graduated from Colorado College with his undergrad. And Jonathan is the John P. Holton Chair on Health and the Environment. He served as a lead author for the IPCC, and he is a member of the National Academy of Medicine, among many other accolades. I'll just editorially say that when thinking about the broad topic of climate change impacts on public health, really Jonathan Patz is one of the first names that comes to mind. He's really made a huge name for himself in the University of Wisconsin and at the interface of the health risks associated with climate change. And a lot of his newer work is looking at the potential health benefits of climate change solutions. So with that, I'll tee it up and hand the mic over to Jonathan. Thanks for joining us today.
Great, great. Well, Tracy, thanks for that nice introduction. And of course, the most important part is that I collaborate with you, which is where the most of the research happens. And so it's really an honor to present to AOS. And I will start sharing my screen right now. And you will see, hopefully you'll see the cover slide. Look okay, Tracy?
It looks great.
Yeah, it looks great, Jonathan. Perfect.
Okay, Tracy muted herself.
I did.
Okay. Okay, so I am going to be talking about climate change and especially quantifying the health benefits from actually doing something about climate change to getting to a low carbon future. And most of you have seen this slide, this summary slide of the health impacts of climate change. If you haven't ever seen this slide, then I'm not doing my job. But basically, you all know about the physical attributes of climate change and how those attributes affect our health through all these different pathways and all these different outcomes. So you know it's a huge public health issue, but I expect that most of you know about these risks. So I'm really just barely going to touch on them before I talk more about climate action and the health benefits rather than these health risks. So I'll start off with the most obvious one, which is heat waves. This is work out of Dan Weimont and his group looking at projections for the future. And Dan looked at all cities east of the Mississippi. This is just Milwaukee, showing that right now we only have 9 days that are above 90 degrees Fahrenheit. But in the future, by mid-century, that number could nearly triple to 25 days. So going from 9 days to 25 days. And this held up for most of the cities in Dan's analysis. And this just came out this year, looking at the IPCC representative concentration pathway, RCP 8.5 watts per meter squared warming. Look at, you can see places like in Phoenix, 6 months above 95 degrees. So this department, the scenarios that we're looking at with climate change. And when this this heat dome hit this past summer, I have never heard of a heat dome, and probably some of you have. And the idea of a long-lasting and expansive heat wave, I have never heard of that expression, but these are things that we need to be concerned about for health. And this also happened just when the moratorium for evictions was about to end. And so I was concerned about this triple threat of evictions, the heat wave, and COVID-19, the idea of going to a cooling center when there's COVID. So there's some surprises that are very concerning. And when they all come together, it's a problem for health. And of course, in this year's news, the worst wildfires in the West that we've ever seen. This is actually from 2 years ago. This was a big fire in California. And look at the air quality. These are just, terrible, very unhealthy, hazardous air. San Francisco was the most polluted city in the world for a little while. So we know that air pollution is deadly, and we know that fires lead to fine particle pollution, and there have been health impact studies of fires, and they show plenty of respiratory illness coming into emergency rooms. But these are things that are becoming more frequent with climate change. Now, on the other side of the hydrologic cycle, there's more extremes in precipitation. And if you look at the global average, this is from the US Global Change Research Program, showing that it's these very heavy rainfall events, the 1 to 2 inches per day type of gully washers, these rainfall events that will be increasing because hot air, evaporates, it evaporates from soil and you get drought. But you all know in this department that hot air holds more moisture. And speaking of moisture, I'll give my throat a little bit. So that when it rains, it can pour when it's very hot. So Steve Vavris and I, along with Sandra McClellan from UWM, did some forecasting for what rainfall will look like. And when it rains too hard and you get runoff, and sewage treatment plants just can't handle all the stormwater, you get these what are called combined sewage overflow events, that the system just can't handle that much volume. And according to Steve Vavris's modeling, in the future, by mid-century, the city of Chicago and the rivers that feed Chicago's water supply will give this kind of risk, a 50 to 100% increase in the risk of these combined sewage overflow events, which threaten the safety of our water. Now, I met with one of your students, with Zoe this morning, and she told me all about her work and on hurricanes, and you all know this more than anyone else about the strong relationship between sea surface temperature and the strength of hurricane winds. But as far as health, we are concerned about, the direct impact. And Zoe was telling me, thinking about, trying to expand on the indicators, not just, category storm, but also storm surge, flood, translation speed of the system, and things like that. So flooding is something that happens with hurricanes, and this is after Hurricane Floyd, showing the hog farms, and think about, this is a terrible picture of all the dead hogs, but this is a waste lagoon, and threats for water contamination. Well, guess what the emergency rooms were trying to prepare for? For diarrheal disease, problems from unclean water. But that's not what they saw. They saw the biggest thing that came into the emergency room was asthma. So after flood events, this picture of mold is a terrible picture, but this is a problem. And for Wisconsin, of course, we're seeing very heavy flooding and increases in this repeated, the 20-year flood becomes a 5-year flood, the 100-year flood becomes the 20-year flood. So this is something that we're seeing comes already. Of course, mosquito-borne diseases are really sensitive to climate. Remember that we're warm-blooded, so our body temperature stays about the same. But this mosquito, that's Aedes aegypti, which carries 3 deadly viruses: yellow fever, dengue, and Zika virus. Whatever the air temperature is, that's the body temperature of that mosquito. So a little change in temperature can go a long way in changing the dynamics of transmission. Well, when Zika virus hit, I asked Dan Beaumont to tell us what the temperature was like just before that epidemic. And Dan constructed these images. He constructed a 60 years of data, so you could have a constructed average temperature, and then he compared these. And this area, these are two standard deviations above that 60-year average. Dan and I put together this paper, but unfortunately we got scooped by somebody that put this in the proceedings of the National Academy of Sciences, that showed that the vectorial capacity of that mosquito, the ability of that mosquito to transmit Zika and dengue fever virus, was at its highest level in a 60-year record. So, and it's temperature dependent. The viral development in the mosquito, the biting rates, a lot of this is temperature dependent. So unfortunately we got scooped, but at least this is an important piece of science that got out there, that extreme El Nino had an incredible biological effect. Now, I tell people that generally, Zika and dengue are virtually the same. It's the same virus family, it's the same mosquito vector. Treat them the same. But I was wrong, because 2 years ago, Sadie Ryan and her group did some laboratory studies and found that Zika virus transmission is optimized at a temperature that's 5 degrees centigrade warmer than the optimal temperature from dengue fever. So it's possible that that very extreme El Nino event and those extremely hot temperatures may have had something to do with Zika's, huge epidemic. Of course, all these diseases are complicated. International travel is involved, but the bottom line is that those unprecedented climatic conditions may have opened the door for Zika to become much more established and spread broadly. The final impact I'm going to talk about is the effect of hot temperatures on crops, and thinking about a climatic envelope in which crops grow. It can be too cold or too warm. This model from David Patz from UW Seattle shows that by the in red will have a 90% probability or greater of having a record-breaking summer temperature. And according to Roz Naylor at Stanford, she estimates that that amount of warming could double the people at risk for hunger. So this is an enormous health issue. So, you know, that in a nutshell is what are some of the things we're really worried about as far as health and climate change. And what people are also worried about is after COVID, you know, people are, you know, will people fear the trade-offs of solving yet another global crisis? When, you know, prior to this vaccine getting circulated, you know, the amount of hardship and shutting down the global economy, you know, there's been a lot of suffering. And so when we're presented with yet another huge global crisis, are people going to be able to deal with it? Well, my argument, and I've been arguing this for about the last 6 years, is that, and unlike COVID, but my argument is that combating climate change could be free, even a net benefit. And so, you know, this is a paper that Tracy and Dan were on with me, Climate Change, Challenges and Opportunities for Global Health. Solving the global climate crisis could be the greatest health opportunity of our times. And publishing with 2 past Nelson Institute graduates, PhD graduates, a low carbon future could improve global health and achieve economic benefits. So Valerie Stahl and Vijay LeMay are very active in this area. And in this last paper, the 3 sectors that we talked about, and which I think many people are teeing up as where we have the most to gain for health benefits. Obviously, the energy sector, considering that 7 million people die prematurely every year from air pollution. And of course, Tracy and others are very expert in this field. The food sector, energy-intensive diets, especially high in red meat, are a problem for the environment and for our health. If we got to a universal recommended diet that I'm going to show you in a minute, you could save 11 million deaths a year. And finally, the transportation sector. You know, our over dependence on the automobile is leading to physical inactivity. The World Health Organization estimates upwards of 5 million people die every year from not getting exercise. So there's an opportunity there as well. Now, I want to just stop on COVID for a second and say that air pollution has, you know, circled back to be a primary problem with the risk of dying from COVID. This is a study from Harvard University that compared 16 years of air pollution over the United States versus deaths from COVID-19, controlling for socioeconomic status, population density, all the key confounders that you should control for. And they found a striking relationship. Just 1 microgram of PM 2.5 was associated with an 8% increase in dying from COVID-19. So here we see, you know, getting off of dirty energy and getting to clean power and cleaning up the air is something that immediately would be beneficial for health from risk of dying from COVID. And people have been asking this question, you know, the global economy has been shuttered because of COVID-19. And look at this, this is, again, Tracy is an expert in satellite assessment of air pollution. This is looking at satellite assessments of nitrogen dioxide over China before COVID and just 2 months afterwards. Actually, no, that's less than 2 months. So you see, you know, shut down industry, and you can easily see the air quality improvement. This is the same satellite imagery of NO2 over France and parts of Europe last March versus this past March. and in the United States, March of 2019 and March of this year. So it's not rocket science that you shut down, fossil fuel, the fossil fuel economy, you're going to see improvements in air quality. And who would have ever imagined that in India, with these mega cities in India, that you would see this green, clear air quality index, unbelievable. Now, there's a recent study published on trying to quantify that benefit. That much air pollution reduction, what would it mean? Well, over about a 2-month period in China, that equates to more than 24,000 lives saved, and in Europe, over 2,000 lives saved simply because of the reduction in air pollution. And what could be any clearer than this picture that, raise your hand if you didn't see this picture. I'm sure you all saw editorials like this. This is New Delhi before COVID and after COVID struck, shutting down the fossil fuel economy. And remember that, millions of people die prematurely every year from air pollution. So when you see a picture like this, you can't help but ask this question. This time, do we really want to uncork the current fossil fuel economy? Or do we want to get to a clean energy economy where everyone prospers? And of course, we've been hearing this from the youth movement. There's Greta Thunberg with her school strike for climate, which of course has taken off, and she's had a platform. There she is with the Pope, and telling U.S. Congress to wake up. And I think most of you in this department already know the why here, which is that, after the Paris Agreement, the world leaders asked the IPCC to do an assessment. They asked the question, what would it take in greenhouse gas emission reduction to stay below 2 degrees centigrade warming? Above 2 degrees, the impact scientists are saying, ecosystems are going to collapse. There's going to be positive feedback. It's going to be really nasty. Stay below 2 degrees average warming. And if possible, and this came out of the Paris Agreement, can we stay below 1.5? What would it take to stay below 1.5 centigrade warming since the industrial period? Well, the shocking news, unfortunately, was that we would have to cut emissions by 45% in 10 years, almost half in 10 years, and get to net carbon zero by 2050. So this is why we are throwing out the term climate change, and there's history behind that term anyway, and beginning to call this the climate crisis. The head of New Zealand, the Prime Minister of New Zealand, is now calling this a climate change, a climate emergency. So this is, cutting emissions in half by 10 years. That's pretty rapid. And just a reminder of, what we have to gain by cutting emissions. And this is, a study showing where, you see the projected mortality from coal-fired power plants in the United States. Some very famous scientists wrote this paper in 2010, Greg Nemeth, Tracy Holloway, on implications of incorporating air quality co-benefits into climate change policymaking. So instead of just having climate mitigation as the end goal, when you stop polluting with greenhouse gases, stop those emissions. When you burn coal, besides CO2, what else are you emitting? All those nasty, harmful pollutants like fine particles and sulfur dioxide. So Greg and Tracy and Paul wrote this paper in 2010 for the US, showing major health benefits simply by the reduction in fine particle PM 2.5 that goes along with reducing greenhouse gas emissions. Later, Jason West followed up on their study and took this, did this internationally, and asking the question, okay, if this is the cost of clean energy, you know, investing in technology to reduce emissions of CO2, how much would it cost to reduce 1 ton of CO2, to not emit 1 ton? Estimate is, but for every ton of CO2 not emitted, how much less PM 2.5 is emitted as well, and what's the health benefit? And the average globally is about $200 for reduced mortality and morbidity and lost work. And so I asked the policymakers, which number is bigger? When most of them are focused on this $30, we don't want to pay more for fancy clean energy. And yet that number, the health benefit, is far greater. And in other parts of the world, like in South Asia and you know, more polluted countries, you know, it's huge, you know, huge benefit. Well, you know, if you've been following work from Greg Nemeth, you would now put a big question mark next to that $30, because look at the price of solar in the last few decades. Since the 1970s, the price of solar has dropped 99%, and it's dropped. Solar and wind have dropped just in the last 7 years. They keep dropping faster and faster. According to the International Renewable Energy Association, the Renewable Energy Agency, their report last year showed that if you forgot about any subsidies for energy, that for the first time ever, the cheapest way to generate electricity is from renewables and batteries. So we don't need to have to think about higher investment costs. Greg and others are showing us that, you know, we just need the political will to get to renewable energy. Now, don't ask me since COVID, because I know that the price of oil went negative. But again, I'll just go back to this report. And, you know, as far as net trends before COVID, this is what it looked like. And there have been studies looking at renewable energy portfolio standards, comparing the investment costs, which is in the black bar here. The gray bar is climate benefits, so like reducing greenhouse gas emissions and reduced agriculture and health risks from climate change. The red bar is the immediate health benefit. You know, work like Tracy Holloway's and Greg's showing that, you know, you have an immediate benefit from reduced air pollution when you reduce dirty energy. Well, if you were to double the renewable energy portfolio standard for this is the Rust Belt area that this study was on, from 13% to 26% renewables. Well, higher investment in the clean energy, but much higher benefit in health benefits. So again, it's the health benefits. And according to this study, they found that the health benefit was about $94 per ton of CO2 that you could reduce, that would be reduced. So we are working very much in this co-benefits air pollution area. Nick Mayu is the leading person on this. He's a PhD student in the Nelson Institute that is following up on work from David Abel, and which I'm going to show you in a second, and looking at, you know, a scenario of 100% decarbonization of electric power, looking across sectors. And I'll save the details for Nick himself when he comes back and lectures to you, or when he defends his thesis. But this is what we're seeing is, you know, somewhere in the neighborhood of $500 billion in saving every year if the U.S. could get to 100% clean energy. And if you ask me really difficult questions on this, I'm going to just deflect them to Nick if he's here. So what we were inspired by was one of Tracy Holloway's students, David Abel. David Abel and Katja Spear put out this report year, asking the question, can Wisconsin get its energy from in-state sources? Because we spend a lot of money on coal-fired state. And this is the scenario that he came up with. Lots of solar, a little bit of wind, and you can see these others. Leaving nuclear as it is, just leave it at 4%, don't cut it and don't increase it. But this is a pretty clean energy scenario. And the bottom line was that Wisconsin could, in fact, get all of its energy from in-state and save a lot of money and a lot of health issues. With this scenario, with the reduction in PM 2.5 and ozone, we'd see 1,900 deaths avoided and all these different health outcomes avoided because of reduced PM 2.5 and ozone. And that would equate to $21 billion a year in health savings for the state of Wisconsin, as well as create all these new jobs, which I'm not an expert in, but as far as political will, I think this is something that needs to be on the table. The only thing that I would say is that jobs are beneficial for health, but so real rationale to move on this. I want to change sectors and very briefly just show you one big study about the food sector. This is from a very high-profile medical journal, The Lancet, and their Food in the Anthropocene, the Eat Lancet Commission report on healthy diets for sustainable food systems, from sustainable food systems. And this is a busy graph, but I just want to point out that everything in this shaded area to the right, this is all excess. Like, we eat way too much red meat and too many starchy vegetables, and everything here is in excess and not beneficial to our nutrition. And according to, these are the best the best nutritionists in the world that are on this Lancet Commission, and they are recommending this a universal healthy reference diet, which is nothing new to you. You already know it, which is more vegetables, fruits, whole grains, legumes, nuts, and unsaturated oils, low to moderate amount of seafood and poultry, no or very low quantity of red meat, processed or starchy vegetables. So you already knew that. You know that that's the best diet. Well, if the world followed this diet, I'm only going to show you that up here the red meat, pork, and chicken has these are very high impacts when you think about the energy involved with greenhouse gas emissions, the land use. Think about the pastures needed to grow livestock, or the CAFOs that create a lot of greenhouse gas emissions, and the energy use, and the acidification potential, and the eutrophication from the fertilizers. All of these very impactful areas that are damaging the environment. If you look at that, if you were to get to this universal diet, we would save about 11 million lives every year and reduce environmental effects of that food production. So, and of course, with our postdoc Valerie Stahl, she's been working on entomophagy, eating insects. And here you compare nutrient content of farmed crickets versus conventional animals. Notice the protein, the crude protein content is very good. Fat level is pretty low fat. There's protein, there's fat. And actually the fat in crickets are the good fatty acids, the omega-3s, and you also get increased fiber. So we need to be thinking outside of the box when we think about food systems. And finally, I'll end by this last sector, the transportation sector. Because of our lifestyles in the United States, a majority of Americans don't even meet the minimum recommended level of physical activity. 30 minutes of vigorous, 30 minutes of moderate activity or more every day. And these are just tragic numbers here as far as the rates of obesity in adults and children, and the number of Americans that die from heart attacks every year. So this is a bad situation. And obesity and diabetes, these are before COVID, these were the #1 epidemics in our country. So this is where I see a huge opportunity, because this is work one of our students, Maggie Grabo, looked at the amount of car trips that are done that are really short. And this is in collaboration with Tracy Holloway's team, looking at air pollution and physical fitness. But if you were to turn these short car trips into bike trips, you will, let's see, yeah, I think we're out of place here. Okay, well, I'll show you the results in a second, but hold on to this for a minute. Thinking about if you could convert those short car trips into bike trips. I want to show you nationally a study looking at, comparing cities across the country, comparing obesity rates and diabetes rates from the cities with the highest levels of walking and cycling versus those with the lowest. And you can see these changes, 20% reduction in obesity, 23% reduction in diabetes. So it's not rocket science. We know that physical activity is helpful, but when you design active travel out of an urban plan so that people don't even have the choice of biking safely or have mass transit and walking, and they have to drive to work, that's unethical, and it's also unhealthy. So, and exercise, not only does it burn calories and you reduce the risk of obesity and diabetes, but look at all these other benefits from exercise. Now, the results of our study with Maggie Grabo and Scott Speck and Tracy Holloway and myself, we showed that if you were to swap the tailpipes for pedals, that was the headline, you'd see a reduction in air pollution simply by getting the short car trips off the road in the big cities, the 11 largest cities in the upper Midwest. And if you were to convert half of those short car trips to bicycle trips, and only for 4 months of the year in the summertime, you'd have an increase in physical fitness. And so those combined benefits of cleaner air and physical fitness would save this many lives per year and this much savings in avoided mortality and hospitalization and absenteeism. So, it's not, we don't need to wait for it. We just simply need to be aware of these huge benefits. We need to design cities for people, not just for automobiles. So our health-oriented transportation group, which is it's a research project in the Global Health Institute led by Sam Yalkin. And we're running these scenarios of comparing the average physical fitness from commuting, so active travel, and seeing if we can ramp that up and what would the benefit be. If you look here, the average U.S. Active travel by bike and walk for commuting is less than 1%, 0.9%. If we were to get to the level of biking, and this is just biking, we're talking about biking, get to the level of biking for Wisconsin, which is 6%, we'd be saving about 20,000 lives every year. If we got to the level of Boulder, Colorado of 10% bike commuting, we're saving over 30,000 lives every year. And as I mentioned, physical fitness is not just about calories and that type of benefit, but with COVID here, we are thinking about infectious diseases and we're thinking about the immune system. And aside from these, burning calories, contracting muscles are factories of beneficial anti-cancer and cardiovascular disease chemicals and a boost to the immune system generally. So exercise is an incredibly important, health prevention, disease prevention tool that we have. And if we can really factor that in and realize that a majority of Americans don't get enough exercise, this has got to be a high priority in our planning. I'll end with one last piece about urban planning, showing that when you think about the urban setting, that green space is really important. For those of you in your department, I'm sure you're focused more on green space, maybe about the urban heat island reduction, which is an important thing to be thinking about. But also, there are studies that show that it decreases depression, stress, and anxiety significantly, very significantly. Also, green space and the idea of social capital and social cohesion and things like that. Here's a study published last year in the Proceedings of the National Academy of Sciences showing an association between the risk of developing a psychiatric disorder anytime during your life compared to childhood exposure to green space. This is from Denmark, and it shows wherever you live, be it in a rural area, small town, a suburb of the capital, or in the center, that the more exposure to green space you have as a child, you're less likely to suffer from psychiatric disorders throughout your lifetime. So another one of these benefits when we're thinking about either greening cities for urban heat island, but here's another benefit for not only reduced risk of dying from a heat wave, but also mental health benefit. So I'll wrap this up by showing you an image that I thought was quite striking. Why don't we treat climate change like an infectious disease? And you think about the urgency and how the entire world is unifying to pull together through this huge epidemic, global epidemic, a pandemic, because after all, climate change is a global health crisis. And with that, I just would wrap up and remind you that climate change poses health risks, but climate action offers huge opportunities. I also encourage you to promote this message. I have a 19-minute TEDx talk. If you just Google my name and TEDx, it's important to spread the word that climate change is about health, because the health narrative has been shown by communication scientists to be one of the, if not the most important narrative to help change attitudes on climate change. So with that, I thank you. You can follow me on Twitter, and I'm open for questions, and I'll stop sharing my screen.
Thank you, Jonathan, very much. There's a lot of, covered a lot of ground, a lot of exciting stuff. I love all these little emoticon clappies coming through. I'll hand it over to Pete to be the moderator, but maybe I'll just start out with one question. Is that I'm wondering, I think there's a lot of people, maybe students especially, in the AOS department who are interested in connecting with health issues. And I guess, what advice do you have to atmospheric scientists at whatever career stage, but especially students who are interested in building interdisciplinary collaborations or learning more about public health? Like, I think how does somebody move in that direction in increments that are appropriate for someone who's still staying in the department?
Right. Yeah, I mean, of course, like everything in our complex world, the world has problems and universities have departments, and to really solve problems, we need to have multiple perspectives in the room. And so I think that it's really, one when you think about the diverse pathways through which climate affects our health, the many exposure pathways, there are any number of climate questions that need to be asked that have health relevance. Just in my meeting with Zoe this morning, all sorts of questions about hurricanes, and if hurricanes are going to become slower in their movement and yet stronger in their power, that's going to be huge issues with flooding. And with flooding, there are enormous health challenges with flooding. You can ask, any one of these climate issues. I didn't show things about temperature and pollen and ragweed pollen and asthma. There are just so many, and then every single one of these infectious diseases is so complicated, and climatic factors, be it mosquito-borne diseases or tick-borne diseases or other types of infectious diseases, even COVID. There are big questions that atmospheric scientists can hook up with health professionals and health researchers to help answer them, because we don't know a lot of these dynamics, the transmission dynamics. How do these different climate parameters, temperature, humidity, all sorts of things, what do these mean for health risk? Lots of unanswered questions. We need your help.
Okay, I guess I'll take over here. Let's open it up to any questions. Let's offer it up to graduate students or just students in general first. If there are any students that have any questions, either go ahead and raise your hand or type them in the chat, or just go ahead and unmute and have at it. No questions from our students. Susan.
There's one.
So you mentioned that with COVID, all the atmospheric pollution levels have gone down. Does that buy us any time in terms of, you mentioned those 2% growth by 2030 we need to reduce the pollution so much? How will that affect things in the future?
Yeah, that's a great question, and I think there was a recent study that came out. I heard about it, but I haven't seen it. Maybe Tracy has seen it. But the number, what COVID shows us is that it's a demonstration of how much pollution is really out there. I mean, it's unbelievable when you see these before-after pictures, because you can look at statistics and say 7 million people die every year from air pollution. But statistics they're not like a picture. And when you see these before-after pictures and people say, oh my God, I'm breathing that dirty soup every day. It's that type of communication that is important with COVID. As far as having a real difference in answering your question, it's so temporary that, if we were to maintain the level of reduction over a long period, that would be meaningful. But I think, it's just sort of a demonstration, and it's a less than a drop in the bucket when you think about what has to take place. If we can truly build back better and come out of COVID and say, whoa, we don't want to go back to that dirty past that we had, and take this golden opportunity to build back better, well, then there's a lot to be said and a lot to gain from coming out of the COVID pandemic. Tracy, do you want to comment on that? Did you see, I heard news about something that came out that said it's a blip that will have no significance other than a demonstration of what it could be like.
Yeah, I mean, I think that bigger change will require more of an infrastructure change as opposed to, the kind of behavioral modification that's been happening But I think the biggest sort of, I'd say, long-term opportunity is around telecommuting, because, you know, a lot of people don't like driving to work anyway, and that is a big part of our vehicle emissions. So I think it's a complex question about sort of where will there be systematic, lasting change from these temporary measures.
Great, great.
Okay, any other student questions? Nora, go ahead.
Yeah, I just want to ask, what will happen if we just get rid of all the food waste instead of changing the diet style?
So that's a great comment, and it's one of these things that we need to do. All of these things we waste in the United States. 1/3 of food is wasted. Globally, on average, 1/4 of all food is wasted. And you know, there are different things in the rest of the world. It's more in the field. In the United States, it's post sales. So enormous issue. So we need to solve the food waste problem. But I think that you know, it's something that we would have to do. We should eat less red meat as well. So it's not one of these either ors. It's something where food waste, a huge issue. We should grasp with that as well. Great comment.
Yeah, thank you.
Okay, last chance. Any other students? Otherwise, I'll open it up to everybody. Karen, go ahead.
Okay, you were talking about how Zika and dengue were different in terms of temperature. I guess I missed the practical implication there. What does that tell us that we need to be thinking about?
Yeah. So, you know, the idea that Zika virus and dengue virus are in the same virus family and carried by the same mosquito, so their disease ecology, the transmission would be very similar. You know, whatever climatic factors favor dengue would probably favor Zika. And I think that is true for the most part. But what some new laboratories studies showed was that it's possible, because does better with extremely hot temperatures, 5 degrees centigrade warmer than dengue, that it's possible that that extreme El Nino that gave us these really hot temperatures throughout South America, that may have allowed Zika to erupt. Maybe it wouldn't have. Maybe it would have just come in from international travel and been small outbreaks. But it's what that lab study shows is that maybe that it was that extra boost in temperature that caused the timing of Zika to erupt when it did erupt. And maybe in the future, when we see more of these extremes, maybe those are the times we should be wary of Zika erupting again. Of course, there's immunity and things like that, and when various populations build up that have no immunity to Zika, you know, it's probably going to erupt again if we have a really hot El Nino like before.
Thank you.
Okay, there's a question in the chat from Isaac. What do you perceive the role of business will be?
Well, a huge role. I mean, I think that, well, already lots of businesses are seeing that a low carbon energy future is in the cards. And so they don't want to be behind the 8 ball. They want to be, you know, they really want to get out in front, and we don't want other countries to be leading this low carbon economy. So I think that they see that. They also see inevitable prices on carbon. I know that Exxon and other oil companies, in their business plan, they build in a price on carbon, just expecting that it will happen. So businesses have a big role, and especially when you have, you know, you need the government to come in and lead with investment. But where you have stagnation in government policies, businesses are leading. Businesses and mayors are leading and saying, wow, you know, we're making money. Gunderson Health is known for going to zero carbon emissions, and they, as a health health system, they are using methane gas from the La Crosse city dump, and they are saving a lot of money. So they're going green and saving money. So big role for business.
Okay, any other questions? Go ahead. Dan.
Hi, Jonathan. Thanks for a great talk. It's always fun seeing all the different aspects of health impacts and whatnot, and the work that's been done on that. I was interested in the role of business versus the role of federal government, and what do you see as opportunities with the changing political situation with Biden and with John Kerry as a climate czar?
Well, it's a new day. I mean, it's like night and day, a huge difference. And my feeling is that you need business sector to step forward, but you also need government investments and programs, and you need public education and engagement. So you sort of need, I see this tripod, this three-legged tripod of getting the information out, getting the public on board, industry on board, and the government. I don't think you can do it I don't think it can be without government investment. To go with a carbon tax that ideally is equitable, and that's tricky, but an equitable carbon tax by itself, that's important, but without directed government investment, right out of the gate, I think that I don't think things will happen fast enough. Industry is moving fast, and they're realizing that they have everything to gain by going to clean energy, and they see that's the way of the future. But I think you also need the rapid government investment as well. So yeah, we're in a new day with a new administration. So.
Yeah, it's interesting to hear your comment on this tripod of, I mean, in the last 4 years, we've certainly seen industry bearing the brunt of movement on this, and we haven't seen anything from the federal government, obviously, but it's been a 1 or 1.5 legged tripod with the federal government being nowhere. The other thing I guess I'd be curious to hear about is issues of equity in this, and what we're realizing about the impacts of climate change and the disproportionate impacts on communities of color.
Right. Well, number one, the impacts are very real. You go across countries, and the poorest countries are the least responsible for causing the problem, and they're also the most at risk. If you go within our own country, in Madison, Wisconsin, we have low-income housing, and that's where you have people that are suffering the most from these repeated floods year after year, and kids with asthma coming out of these houses that have mold and are impacted. Big equity issues right there. As far as the equity issues with climate action, I mean, there's certainly a price on carbon needs to be done equitably, because those people, if you think about cars, the people driving the least efficient cars are the poorest. That's one thing. So you certainly, if the price of gasoline goes up, that's a problem. But of course, we need to get rid of gasoline altogether. And if we can get to renewables as more are electricity based, and really switch away from gasoline, that would be really beneficial. But I think any of these interventions for mitigation and getting away from greenhouse gas emissions, there are equity components as far as where do you do those, which plants are closed down, where do you build bike trails? Is it going to be in wealthy neighborhoods, or is it going to be in poor neighborhoods? And if you build those bike trails in poor neighborhoods, are you actually going to be empathetic and smart enough to realize that there's a bike culture issue and education, that you don't just build it and they will come. It's got to be a comprehensive, culturally sensitive program. That's where we need to be sensitive as we do these interventions. We need to be thinking in that way right from the start, and engage minority communities in the planning.
Thanks.
Okay, we're up against 4:30. Maybe we have time for one quick question, if anybody has one burning question yet.
Not so much a question, Pete, but a comment. John, great talk. This is John Martin here. I'm reminded of the baseball owners in the 1920s when radio came on, and all of a sudden they were petrified they were going to lose revenue because no one would come to the stadiums anymore. I think part of the leg on the stool that the government needs to really do is challenge us to see this problem as an opportunity, and you talked about that to a good extent in this presentation, but I think that should be hammered home every single day, and we should stay out of the weeds as much as possible and say we have a global challenge in front of us. We can win the race to the new future. We don't want China or India to beat us, and I think we need to start talking like that on the national level.
And that is a note that I agree with 500%, and a perfect comment to end with, because I think that's where the action is, and even in the science of communication of this, the positive messaging is more impactful. So let's go do that.
Great, I'm game.
All right, there was one other question by one of our students. I don't want to keep you too long. She wondered what the role of developed countries versus underdeveloped countries would be, since there's a need for the poorest countries to develop their economies and well-being.
Yeah, that's a very important, big, tough question that I will only begin to just slightly answer, which is that clearly the wealthier countries have, they have the wherewithal and ability to invest and switch over, but they invest in poor countries, and where you have the huge need for development in the poorer countries, that's a golden opportunity. That may be the lowest hanging fruit for the world as a collective group. Sure that those poor countries can leapfrog dirty technology, just like Africa leapfrogged landlines and went straight to the cell phone. I get better cell reception in Ethiopia than I do in Wisconsin. So, this is where there's an opportunity for the world to come together and to invest in clean technology in these poor countries. There needs to be a unified effort in that way.
All right, well, thank you again, Jonathan, for a wonderful talk. Let's thank him again.
Thank you all. Yay. All right. So just tell me what to do. Pete, you're muted.
Yeah, I'm supposed to be the expert at this, aren't I? I want to say thank you for a wonderful talk. Thank you to all of our speakers through the Colloquium series through the fall. And we will be moving from Blackboard Collaborate to Zoom for the spring semester. So watch wherever you heard about this talk. We'll have information about that there. And we look forward to seeing you all again in the spring semester. Everybody have a wonderful last week of classes break, and we'll see you here on the flip side.
All right. Thanks for the technology.
Yep.
Thanks, Tracy.